Hi, welcome back to Tama Talks Tox. I'm Tama, board-certified nurse practitioner, and today we have expert plastic surgeon, Dr. Kevin Hanz. He's here to tell us the alternative options to facelifts and liposuctions. Dr. Hanz is a board-certified plastic surgeon with 20 years of experience in aesthetic and reconstructive surgery. He trained in plastic surgery at UT Southwestern, one of the top-ranked programs in the country. He's the first surgeon in Dallas to offer FaceTight and BodyTight. Welcome.
Well, thank you so much. It's an honor to be here, and excited to share some of the innovative things we're doing in that minimally invasive sector. So, Tama, thank you.
Yeah. So how does FaceTight work?
So FaceTight is a technology that's brought to us by InMode Technologies. And when we talk about FaceTight, we're talking about minimally invasive, aesthetic refinement. So to get into the nitty-gritty details, we're basically going in with a cannula, very similar to what most folks would think of for something like liposuction. The difference is with FaceTight, we're actually injecting, and what we're injecting is energy, and that energy comes in the form of radio frequency. So think cannula goes in, we're going to improve the looseness of the skin or the skin laxity to result in, a more tightened skin envelope that can reverse some of those signs of aging. And this is often done in the neck and along the jawline to really enhance that lower third of the face.
Right. So the RF is this a tightening.
Exactly.
Where people have jowls and things like that.
Exactly. We think of radio frequency as our workhorse in that tightening world. And so you're exactly right. Early jowling, a little bit of, looseness or laxity underneath the chin. That's where FaceTight really can get in there and make a difference when, say, Botox or fillers are no longer an option for that lower third of the face.
Right. So it's for someone who's not quite ready for a facelift yet, but they want some enhancement, they want some tightening, they want some improvement in the laxity.
Absolutely. And we often refer to these patients as our gap patients. For whatever reason, they're either not needing something more invasive or they're just not ready to take that step. And so this is an excellent way in a very short procedure with minimal to no downtime, they can achieve facelift-like results using the radio frequency based technology.
And so that's the next thing about the downtime. 2-3 days, you would say, versus traditional facelift?
That's correct. The procedure itself is about 45 minutes, and we ask patients to wear a little neck compression garment for 2 days. They can continue to do so at nighttime for the remainder of the first week, but literally can get back doing full athletic activities and, activities of daily living in as short as 3 to 5 days. So it's a very minimal downtime procedure. We worry a little bit about some swelling during those first 3 days, but beyond that, nobody would know they had anything done. And they'll begin to see results as early as 3 to 6 weeks following the procedure.
That's fantastic because no one has downtime. We're very busy. We want to go back to work or go to activity, daily living, or parties.
That's right. Absolutely. So, having a minimal downtime procedure, like you mentioned, absolutely.
Yeah. Everyone's very busy and active, and exercising too. We can't miss that, right?
Exactly.
And then you've told me about the ACE procedure when you combine FaceTight with Platysmaplasty.
Correct. So ACE is sort of taking that next step beyond the FaceTight, where we're going to make an incision, but it's limited to just the neck. And so we often see as we age those platysmal bands in the front of the neck, and as they separate, they can create those two lines coming down the front of the neck. So the platysmaplasty is a part of a facelift, but what we're going to do is perform the platysmaplasty and then rely on energy in the form of FaceTight to work on the jawline and the neck. And so we're doing a facelift-like result with just a minimal incision. And again, this can be done completely awake, so no anesthesia and minimal, downtime, minimal recovery. And it's for those patients where we can tighten everything around those platysmal bands, but if we don't address those, they could actually worsen as the skin tightens over that separated muscle in the neck.
Right, because we know platysmal bands pull the neck down.
Correct.
Yeah.
So this combines the ACE lift, and it stands for awake cutting edge, and it combines that FaceTight procedure with a simple platysmaplasty. And again, done in as little as an hour with very little downtime.
Very nice. Are you one of the few surgeons in Dallas who performs ACE, or
so ACE is really a term that we coined to take advantage of these minimally invasive cutting-edge technologies combined with a platysmaplasty. So that's unique to Hanz aesthetic plastic surgery, and just a novel approach to the anterior neck and lower face.
Mm-hmm. Very nice, very nice. And then what about the awake deep plane facelift? Since we've talked about less anesthesia is better for the patient, better for recovery.
Exactly. Most patients don't realize that a deep plane facelift, and let me just talk about the deep plane for a minute. When we say deep plane, we're really separating sort of the face from a skin-only facelift to, again, that deep plane. The SMAS, exactly. And so the SMAS is a layer of the face that's continuous with the platysma that we just talked about, but envelopes those muscles of facial expression in the cheeks, and as we work our way up into the mid-face and lower third of the face. And so if we manipulate that deep plane, we're going to get a more natural result that provides much more longevity for the patient in terms of results. And so most people think of this as a fairly invasive procedure, but at Hanz Aesthetic Plastic Surgery, we're actually doing that awake. And I'm happy to talk about that awake model, but most patients just don't realize you can do that. And it's really, quite attractive to a lot of our patients.
Mm-hmm. That's amazing. So what kind of tumescent is what you use?
Exactly. So first and foremost, we're going to provide some medication, typically Xanax, to calm the nerves, kind of ease the anxiety, and have the patient in a more happy, comfortable place. We'll often combine that with just a very mild narcotic. And again, it has the patient relaxed and in a good place. Now we're going to add what's called tumescent solution, and this is our numbing solution. So IV fluids mixed with lidocaine, a little bit of epinephrine, and that's going to take anything that would feel like a poke, pinch, or pain and make it feel like vibration, tickle, pressure. And so in that setting, the patient is very comfortable. We're able to perform the deep plane and provide the same results that patients often have to go under anesthesia in order to achieve.
All right, that's fantastic. And you have your own OR in your office, so it's very convenient for patients.
Yes, that's correct. When we put together the clinic, we also built a surgery center that's fully equipped, and so everything is right there at our address on Lemon Avenue. So
okay, and then let's talk about BodyTight.
Yes. So these same principles that are applied to the face and neck can be used throughout the body, and often patients will hear, oh, "Can we tighten?" arms, and literally we're taking it all over the body. So beyond the face and neck, we're going to the arms, the kind of front bra roll area. We'll do upper and lower abdomen, waist, flanks, inner thighs, posterior thighs, banana roll. Literally, almost if you can conceive of it, we're using the same radio frequency based technology to help with tightening in other areas of the body.
Tightening and reduces fat.
Yes. So that energy, which is heat-based, both will reduce the presence of stubborn fatty tissue and tighten the skin at the same time. And so it's all through that single cannula that we talked about earlier.
Would you need to do liposuction as well while you're there, or that's a separate thing?
It's a great question. It really depends on the individual patient. If there's a fair amount of stubborn fatty tissue, then we simply combine the two. We call this RFAL or RFAL for radio frequency assisted liposuction. And we'll do some debulking and then use that radio frequency in the form of BodyTight to help, with our tightening and that last bit of stubborn fat that needs to be reduced.
Could it be through the same cannula?
So it's through the same entry site, but a separate cannula. And I sometimes simplify this for patients. One cannula goes in, designed to take out, and now we'll introduce that second cannula in order to provide the radio frequency and the tightening.
Gotcha.
And about a year ago, we added, I'm constantly adding kind of the latest, greatest. So the same company that brought us FaceTight and BodyTight, which we still use and have available, also brought us something called Quantum. And Quantum is also radio frequency based tightening in just a different kind of cannula format, but we're using that a lot as well. And it's been really successful over the last year. Employing the quantum technology, which again is just radio frequency based tightening and fat melting.
That sounds fantastic. I want to come see you for FaceTight.
Absolutely.
Yeah.
Love to have you.
Yeah. So, and can you tell us the price on like something like that? How much would it be?
Yeah.
And it's just one time only, right? You don't have to do a series.
Correct. This is a one-time treatment, and patients ask, how long will it last? And I tell everybody it's going to last forever as long as you don't age another day in your life. And so in effect, we're setting the clock back roughly 7 years. And I think that's a realistic answer for patients, but it's that process of aging that obviously we're up against. So cost, roughly speaking, is going to be about $5,000 per area.
Okay.
And again, this can be done awake with minimal downtime. And then, individualized pricing may vary depending on the amount of stubborn fatty tissue and the amount of time involved in those procedures.
Okay. And then when you mention Tama or Tama Talks Tox, you get a special prize, right?
Yes, that's correct. It's been a privilege to be here. And so with the Tama Talks referral, if you mention that, we're offering a discount on all of our facial rejuvenation and body tightening services over the next 3 months. And that'll be at the rate of 10 or 20% off, depending on the amount of expenditure for them. And just to clarify that, if it's under $10,000, we're offering that 10% off over the next 3 months, and beyond that, a 20% discount for mentioning Tama Talks.
That's great. So they have 3 months to do this, right? So until August 21st.
Exactly. And so just have to go ahead and schedule, book, and pay for the surgery, and we'll honor those discounts with Tama Talks.
That sounds fantastic. Well, I can't wait to go see you. And also your website is?
Yes, website is simply Dr. Kevin Hanz. That's KevinHanz.com. And you can also follow us on Instagram, Facebook, and also with the YouTube channel, which is simply Dr. Kevin Hanz as well.
Nice. Thank you so much.
Well, it's been a privilege to be here. I appreciate it, Tama. Thank you.
Thank you.